Good afternoon. For some people, welcome back. And for people who are joining us through the Zoom live stream, thank you for taking the time to be with us today. And thank you for making the effort to join this panel discussion. My name is Rahaf. I'm the founder of Raise Your Mental Health. You can call me Ray. And I'm the moderator for today's panel. And our topic is mental health care accessibility in UAE. We'll be talking with our influential speakers on how easy it is to access mental health care, what are the barriers to seeking help, and much more of that. We do hope that by the end of the session that you give us as many questions as possible, because we are here at the end of the day to answer and address those concerns and questions. So having said that, the format will be very simple. At the beginning, I'll be just taking a few minutes for each of the panelists to introduce themselves in the best way possible. And then I'm going to kick off the conversation, and at the end, we will be answering your questions. All right. Now, I'm happy to see a few people here. So let's just test the temperature a little bit. Raise your hands if the following statements resonates with you. I get scared to express my emotions with other people. No one gets scared. Really nice. Dr. Adil, okay. And another lady. I'm okay with seeking help. It's just that I don't know where to go or how to start. Then you are at the right panel. Now, basically, we'll let you know how to start, where to go, and what is the best approach to take care of your mental health. Dr. Adil, I'll start with you. Of course, just please take a few minutes to introduce yourself to the audience, and then Shuruk, and then Dr. Joseph.
And glad to be with you here at EHS and in Expo 2020 in Dubai. This is my third visit to Expo. It's mashallah getting more and more filled with people. And to anyone here, please tell your relatives that Expo is going to finish by end of March. So please take your chance, come and visit Expo. My name is Adil Sajwani. I'm a family physician. And I'm so much interested in mental health. In fact, half of my patients, I do see them daily, are mental health patients. And I believe that mental health is a very important subject. I got trained in the Royal College of Surgeons in Ireland. And I think, I'm not trying to make myself old, but I have about 15 years of experience.
Thank you. Shuruk?
Is it working? It is. Good afternoon. It's an honor to be here today. My name is Shuruk Nafa. I'm a psychotherapist, and currently I'm the acting director of the Student Counseling Center at Zayed University. It's an honor to be here today and to discuss mental health and how we can improve mental health accessibility in the UAE.
Thank you. Dr. Joseph?
Thank you for the invitation, and thank you for attending. I'm Joseph Al-Khouri. I'm a psychiatrist, and I'm the head of department at the American Hospital Dubai, which is a new department for the past year, where we offer mental health services, psychiatry, psychology, and other things. I'm also involved in research and teaching. I've been in charge of teaching residents in my previous job in Lebanon, so developing psychiatric services. And I'm very much interested in the social aspects of mental health. You know, how we make mental health something that doesn't happen only in hospitals and places of treatment, but something that's beyond that and on a social level. And hopefully today we'll be able to discuss this with my colleagues here.
Thank you. Dr. Adil, I'll start with you. Most of the mental health awareness campaigns, they are generally well-intentioned to break the stigma around mental health, to encourage more people to seek help when needed. But we still see that most people are still hesitant or skeptical when it comes to mental health care. So it feels like the campaigns are doing more harm than good when people are not actually taking the step forward. So what do you think is the key here to actually do an effective mental health campaign, or how can we promote it efficiently?
This is a very important question. I think most of those campaigns are made as a part of the company's KPIs. So basically, we have to do a certain part of campaigns, so our leaders in whatever organization are happy, and it's a checklist. Mental health is different from other diseases. Now, if I want to promote the screening of cancers, for example, yes, it's a physical illness, which has a mental health background, but it is mainly a physical illness. So it is a KPI. I need to do whatever screening per month. I need to do whatever campaigns. But this is different when it is related to depression or anxiety. We are an Arab country. We have over 200 nationalities here in UAE. Many or half, or I don't know the percentage of our nationalities are Middle Eastern or Arab speaking. And we have this social stigma here. So if you do a mental health campaign for the sake of a checklist or KPI, you are doing more harms, because you are just doing that to bring more audience, to put a press release, to have a social media ad about it, and that's it. Mental health is part of people's soul. It's part of daily activities. If you want to promote mental health, then you should believe in it. And most of the leaders who are in charge of mental health, they don't even go to seek mental health support for themselves or their family. And I have seen, I think my dear colleagues here also agree with me, many of the leaders who are in charge of mental health, if they themselves are having a low mood or a depression, or they have their wife or their spouse or their son or daughter is having general anxiety, OCD, PTSD, whatever, they don't go to a psychiatrist till now. So why is that? Because we try to promote something that we don't believe in it. So the first part of promoting campaigns with mental health is to have leaders that really believe in mental health support. That's first. Second of thing, digital marketing. We are still promoting through malls, through banners, through some slogans, while social media is the new trend. I mean, I posted a video on my TikTok account, and I'm not active at TikTok at all. It got 2 million views on mental health post-COVID. Can you imagine that? Most of TikTok population are those under 18 years old. And those are, I think, Dr. Joseph will agree with me, the new sector that really need mental health support during our era. So I think digital marketing, digital campaigns, digital awareness is the key if we want to reach those segments.
Thank you so much for sharing that. Before the digital campaigns, basically the company or the entity who's doing the campaign is to actually believe in it, because you're putting your heart into something to leave an impact on as many people as possible. So thank you for that. Dr. Joseph, so as we can conclude from Dr. Adil, when people have easy access after the promotion and the campaigns and all of that, when they have easy access to mental health care, their lifestyles change. Everything gets better and healthier, and anxiety can be reduced, stress is reduced, the unhealthy behaviors or the harmful behavior also gets reduced. What do you think are the gaps between, or that should be addressed to make mental health care more accessible to people, especially for the youth?
This is an excellent question, because in any healthcare industry, there are a few elements that are required for us to be able to access them. Stigma, so seeking help is the first one, and this can be addressed. But once you accept you have a mental disorder or psychiatric disorder, then people fear what the step will involve. Okay, so they have no idea what a psychiatrist is. Some people don't know what the difference between psychiatrist and psychologist. Actually, some of my colleagues at the hospital do not know the difference between the two. And this is obviously despite being trained in Western countries. So That's the first thing in terms of understanding what will happen once you go see a doctor or a therapist and the rest of it. What does therapy means? What are your expectations from therapy? And the entry points to mental health care do not need to necessarily be through a psychiatrist. Mental health care comes in many levels. We call this stepped care. So depending on what problem you have, you might require to see a specialist, but you might also be able to deal with this problem in a clinic or through a general practitioner. We need to understand that people do not know what mental health care means. They don't understand the medication. They don't understand how the medication functions with the therapy. They don't understand any of these things because very simply, it was hidden in a corner in our society, but also in our hospitals and in our clinics and everywhere. So even physically to go and seek help, people sometimes fear looking at the sign for the psychiatry department. And at one point we had a discussion, should we put it in a place where it's visible or it's not? And interestingly, I think even though in Arab society, a lot of people in the United Arab Emirates, whether they're locals or whether they're residents, actually do seek help. And I was surprised, having been in the UAE for the past year, that around 30%, for example, of our patients are Emirati locals. And most of what people ask me, do really people in this country go and seek help? They do. But they do reluctantly. They do sometimes after 2 or 3 years of suffering. They do because somebody strongly encouraged them, while it could have been much easier. And the outcomes then are much better. If you seek help early, regardless of where you seek help, you're most likely gonna get a better outcome. So I think the awareness, the Expo now, I was thinking, you were saying about access to the Expo. How much was spent explaining to people how to get to the Expo? And the multiple doors, and the mobility, and the opportunity, and the rest of it. This is how we should be thinking of mental health. And I think, with now more interest in it, that the leadership, whether at the level of the country or the level of the healthcare industry, should be thinking about these things.
Thank you. I totally agree to that. Thank you. So speaking of leadership, Shuruk, this question is for you. Recently, Dubai police have announced that they are leading with partnership with Omnia, I guess, for the first mental health awareness in the UAE. How does this campaign, or how would it impact mental health awareness in schools, universities, workplaces, when you see Dubai police has already started this initiative? How could that impact the educational system?
I think it's fantastic that multiple organizations and multiple entities are taking this on board. I think it's very important, and as Dr. Joseph was just saying, access to mental health doesn't have to happen at the inpatient psychiatric level. We need to make mental health accessible at the community level. So that involves schools and universities and workplaces, and it involves practitioners, lay people, people in the police force, people in juvenile correction centers, people in rehabilitation centers, people in primary care, understanding the mental health needs of the population and being able to, first of all, detect when someone is struggling or when someone is in distress, and then be able to offer them basic support, and then be able to refer them on, and create these pathways that allow people to access mental health services. I think creating these pathways is really, really important because, as we've all mentioned today, people don't know where to go.
So that's a very nice point. I just didn't want it to slip away. When you said detect, which means to us to be able to read someone's symptoms if they are going through something. And that's, I think, very important and crucial these days at schools and universities. How do you think is the best approach to start introducing mental health at schools or universities?
I can give you one example of one project that we've taken on at the university. At Zayed University, the counseling center has just become the first and only licensed center in the UAE to offer a program called mental health facilitation. It's done in collaboration with the National Board of Certified Counselors in the US. It's an internationally recognized program where, as a center, we are now accredited to teach other individuals, other people, other teachers, other students, basic mental health. So we teach them signs and symptoms. We teach them how to look out for other students, how to recognize when a friend sitting next to them in school might be struggling, and then how to gather a little bit more information, how to meet them or speak to them with empathy, how to listen to their problems. So we really teach them basic counseling skills or basic mental health as a first line of defense, so that they can recognize other people when they are struggling. So at this point, there's actually a training going on at the university right now as we speak. At this point,
how's the feedback or how's the engagement
fantastic.
towards that program?
We launched this end of Q4 of last year, and we've already trained, by the end of this week, we would have already trained 70 people. Students, faculty, staff, to be able to support others, to support their peers, and to create these pathways, allowing people to access mental health services.
That's leadership. That's leadership. Thank you, Shuru. Dr. Adil, yesterday we received a question during the panel that one of the ladies in the audience is finding it difficult to talk with her parents on a mental health issue. What do you think is the best approach to introduce the topic of mental health, either from kids to parents or even from parents to kids?
Well, I think it starts from taking the parent to therapy first, because children are really very important part of the community. Now, I mean, they are shaping the future now. And we all were children one day. Now, we all had problem talking to our parents. It's very hard to find a very highly educated parent. Even highly educated parents, they are hesitant to talk with children about mental health. And even if I'm an expert in mental health, I'm not giving my child a Cipralex or Prozac or any treatment. Why is that? Because it's easy when you advise people, but it is hard when you apply it to your own family. So my advice to children, now we have no children in here, but my advice to parents.
They might be watching on Zoom.
Yeah. So involve your parents on such awareness campaigns. Now, there are many TED Talks about mental health. There are many good YouTube speeches. But again, the biggest mistake, I think, is talking to a life coach. And I'm sorry, I need to talk about that. We have a big problem here in the country with the life coaches. I don't mean to say that life coaches are bad, but certainly they have an important role, but they are not psychologists or psychiatrists. I mean, we have this issue in here that people, when they have a problem to talk about their parents, or vice versa, or when they are having a bad day or a low mood or a marital problem, they go to life coaches. And life coaches are not trained to give therapy. I mean, Dr. Shuruq here, she's an expert in giving such therapies. She knows how to talk to those people, what advices to give. But life coaches are just trying to give a false therapy. And what's happening? People are having family issues, high rate of divorce, big problem with children-parent relationships, till people goes in very severe and diseases, then they go to Dr. Jose for treatment. And this is the problem here. So I think...
So is the problem is they don't know where to go
Exactly.
to get the right
Exactly.
awareness or education on the topic?
Exactly. So we have a big problem that when you are thinking of anything related to your mental health of yourself or your family, you don't know where to go. When you go to your GP or your primary care physician, 90% of them, they are not trained for mental health. And I'm a primary care physician and I can clearly say that. So they just tell you, I refer you to a psychiatrist. Now, we have this lovely thing in Dubai, in Emirates of Dubai, that people here are insured, either locals or non-locals. So, because if you go to other Emirates public hospitals, it takes you 1 to 3 months to see a psychiatrist after a referral, which means you will see him when you are about to commit suicide. Private sectors are very important, and this is the public-private partnership. And this is the importance of seeing the psychiatrist as soon as possible. And he can also refer you to a psychologist to get therapy with the medication. But if you don't know where to go, you will go to ask normal people. Normal people will tell you, don't go to the crazy doctors, مستشفى المجانين, in Arabic we say it. So they refer you to life coaches. Life coaches will make your life miserable, and you will be deteriorating more. So I think having a good campaign with the right access to people where to go.
Thank you. That's a very nice distinction between experts and life coaches. I do have a question. So let's assume new parents got a kid, and the kid is growing up and all of that. How could they make sure that the environment is healthy, the environment is safe, is supportive for that kid to grow up saying, I'm not feeling well?
First of all, we have to accept there is no such thing as perfect parenting, because the obsession with perfect parenting is actually a cause of mental disorders, okay? And I think we've reached a point, especially with Instagram and everything, where, you know, there's competition to create these super kids, you know, that do everything all the time, never a moment. Yes, and obviously we're influenced by peers and the rest of it. So I think we need to think about good enough parenting, the idea that what does a kid need to grow up stable, balanced as much as possible. But even when you do that, we cannot forget the genetics. We cannot forget that no matter what we do, some people will develop a psychological or psychiatric disorder. And most mental disorders will happen before you reach the age of 25. So when I get somebody in his 40s or 50s, the first thing I say to them, what was the first time you thought there was something not right with you? And they can go back sometimes 15, 20 years. And a lot of them will tell me, when I was 12 or 15 and I started thinking X or Y, there was nobody I could go to and talk to about this, because I didn't know, first of all, that this was not normal. And who do I talk to? If my parents are going to judge me or if my peers are going to judge me. So we go back to the awareness and the rest of it of this idea. Now, parents tell me, but we don't want to medicalize our kids. If we go see you, we're definitely going to end up on medication, which is not true. Okay, because I don't get, you know, extra whatever reward for putting people on medication. Actually, I do a lot of time take people off medication. But if people do require medication or do require therapy, it's to the advantage of the entire family. And as Dr. Sajwani said, sometimes the problem is not with the kid, you know, because couples are not perfect, because relationships are not perfect. But a bit of tweaking or fine-tuning, small changes make a big difference. Okay, so it's not necessarily about, you know, major drastic changes and telling the family you're a bad parent, because good parents do end up with bad problem kids, and sometimes bad families end up with good kids. It's a much more complicated picture. So we should not be afraid of seeking help if we feel something is not right. And the question might not lead to, I need treatment, but it might lead to reassurance and peace within the family.
That's a beautiful way to put it out there. Because that's a very common question as well, whether it comes from students or employees or even kids, that when it comes to decision makers, I think it was yesterday as well, it was mentioned that I need my parents' permission to get mental health care. So if the parents are not convinced, but the kids need it or the student would need it, what is the best way to deal or handle such a situation?
Now, legally, if somebody's under 18, we cannot see them, you know, without the parents' consent. This is where maybe counseling centers and school counselors can play a role, because they don't necessarily, or they have a different entry point again to this, and they can raise the issue. Again, most parents are reasonable, and it takes time to convince them. It doesn't come naturally, because no one wants to believe that their kid is not top of their class, the smartest, you know, the best kid. That's how we're, you know, brought up. But you can still be the best and the nicest and the most potential kid, but needing some support. So I think this is where school counseling, to be at a good level, and just to support what Dr. Sajwani is saying, even for me, a license to practice does not make you an expert at one thing. Even me as a psychiatrist, I know my limitation. I know I'm not the best at certain types of things, because I'm subspecialized in one thing, not at the others. So I think we need to also keep in mind that not every psychologist or every life coach or every doctor or everything knows everything. And I hope this is something that schools can understand, because some counselors go outside their comfort zone.
Shuruk, what is the hardest challenge that you have come across during that program or any kind of mental health awareness at the university or with students?
thinking of challenges within the university, I think it's the same as within the society at large. I think it's convincing people that mental health is important and that mental health challenges are valid. As Dr. Joseph was saying, you could be really, really outperforming and doing really, really well academically, but you might still be struggling. So being able to validate these challenges and validate their importance is really important. Getting people on board, getting people to buy into the idea that mental health is important and valid and needs to be center stage because mental health centers in academic institutions support the mission of academic institutions, which is to develop well-rounded, balanced, healthy individuals that will go out into the workforce, build healthy relationships, contribute to the country's economy. So it supports that vision directly, because if it's not just about the academic growth of individuals, but it's also about the personal growth that students need to encounter and need to live through to be able to go out into the world and be the best that they can be.
So, because I keep hearing these things in my head. So we all have missions and visions and campaigns, and we do our best to show people, like, just look how important that is. People want to be the top performers at class, at universities, or at work. They want to be the best in everything, whether it was coming from kids or parents or however, but they're not willing to do the work. Let me burn out myself. Let me overwork. Let me be an overachiever. Let me study all night long. So at a university, do you think that the narrative has changed by encouraging students to take a break every now and then, or even to allow parents to realize that it's okay if he wasn't getting a high grade, but his mental health comes first?
I think so. I think the narrative is changing. I think in lots of different settings now you hear about people embracing a growth mindset instead of a fixed mindset. It's becoming a very popular thing that people are speaking about, which is this idea that we can grow into who we are and we don't need to be perfect, and we can stumble and we can fall as long as because we're just in the process of becoming. We're introducing within the university weeks that we're calling stress-less. So it promotes this idea of self-care and that balance, because, as you say, I think societies are becoming really, really, we're romanticizing the idea of being busy all the time and being booked all the time. And especially with kids. Kids go now from one after-school activity to the next, to the next, to the next, and it's insane. They're really busy, and kids are stressed and they're burning out. And I think we're romanticizing that idea that there's something glamorous or successful about being busy all the time, as opposed to just resting and taking a pause and being able to look after ourselves and our own needs. So I do feel that the narrative, there's a counter narrative. The main narrative is keep busy, keep going, but then there's also a counter narrative, one that's rising alongside of it, saying, hey, can we just slow down a bit?
I mean, I love how you really highlighted the topic of, yes, let's stop romanticizing the other side of what mental health, or what might be a possible cause for a mental health issue. So, Dr. Adil, how do you think could we, or where do you see that topic in, let's say, 2 years or 3 years? Because I think like 5 years ago or 10 years ago, we wouldn't be here discussing mental health openly. So now that the narrative has been changing, entities is doing a lot of campaigns and programs to support mental health and to give the care and support. Where do you see that in 2 or 3 years?
I hope to see ourselves going much faster. I think 5 years ago, those sessions were held somewhere else. So we had those type of sessions before. But COVID-19, when it came, and Dr. Joseph can support me in that, I think the rate of mental health diseases increased dramatically worldwide after COVID. Now, this is due to many reasons. The lockdowns, the loss of jobs, loss of our relatives sometimes, mortality rates. But worldwide, the rate of mental health diseases increased. And that pushed the governments worldwide and the organization to spend more time onto mental health awareness campaigns. So I think COVID came to push people on the importance of the mental health. And I hope we continue supporting those campaigns, not to go back when COVID disappeared. We don't need a pandemic to increase the awareness of that mental health is very important. I'm sure people here watched the movie Joker, Al Joker. Yes. Anyone watched it? And yeah, I think most of you watched it. It is a very nice movie if you love mental health. Joker was a mental patient. He was a psychiatric patient, as we call. And I just caught one part of his phrases when he was talking to his psychologist. He told her, "You never listen. You just keep repeating the same each time." And that's really something that many patients are hesitant to say. So we have a big problem that some medical jobs are becoming a clerk job. Now, if I want to go to a GP, like myself, or a family physician, I have a cold, I have a fever, he will just write for me a PCR test, take some Panadols, antihistamines, go home. I mean, that's fine with a respiratory illness. But if I go to a physician with loss of interest, with a low mood, then it's not just like take some SSRIs, go and have fun in your life, come see me after a month for repeat prescription. We are creating more mental diseased patients by this way. Those who are interested in mental health should have the belief that their jobs are very important and should believe in those campaigns and should increase the awareness. I think we should train the trainers, we should train the GPs more into giving help, because psychiatrists are doing a good job, but they are not enough. Dr. Joseph and Dr. Shuruq, if they sit the whole day, they cannot see the whole population. I think
So do you think it's governments and entities, private entities?
Public, private, they should partner in that. We should train as much GPs as we can to give support to the mild and moderate cases. And we leave the severe cases or severe to moderate to the experts. And we should encourage mental health, not to wait for a pandemic to do these sessions. And we should make the policies more agile to fasten, to support the treatment. Like when Dr. Joseph just mentioned, we cannot treat somebody for mental disease if he is less than 18. This is the law. I mean, and he just mentioned that people with mental disease, they had it before the age of 25. So these two things need to be addressed by the policymakers. We need something through schooling or through whatever, through the competencies judgment, for example. We need to accelerate more into tackling those problems if we want to decrease the mental health, the mental disease in the future.
How far are we from making that happen?
I think we were inferior before COVID. COVID accelerated mental health, and that's I'm very happy for that. But I hope that we continue accelerating. We don't stop when COVID disappears.
Absolutely. Thank you. Before we take questions from people attending, this could be for anyone, for you to answer. We all know that mental health issues or diseases do not discriminate. It could happen to any age, it could happen to any gender. But it's also more common to support or to provide healthcare, mental health care to women and kids more than men, especially in the Middle East. Why do you think that?
I mean, being a Middle Eastern man myself, I think we're not conditioned or taught to express our feelings in words, okay? And again, it varies between different Arab countries, but in general, you know, men are not supposed to have psychological or psychiatric weaknesses or flaws or the rest of it. So if you look even at the presentation in any clinic and you look at how many men versus women and children attend, you'll see that the men are lower. So men leave it for later, they get more sick, they end up with sometimes with addiction problems because they self-treat, or they end up with causing so much harm, because we have to remember that in a patriarchal society sometimes, if the head of the family has a disease that's chronic, then it affects everybody else. And since he cannot be convinced to seek help, we end up with even generations of damages. And I see that a lot, okay? So we need to focus on men's health. And I think the approach to it needs to be specific culturally. And we need people from the culture itself to understand the importance of mental health and to be trained on both mental health and the cultural competency, which we're seeing more and more, okay? People like Dr. Sajwani and other people are like, you know, who represent this new trend. But in general, this was not the case for many years. And I really think that the emphasis on women's health is important, but I feel that generally women are anyway more likely to be in touch with their feelings and more likely to seek help. We know this across the world and particularly in the Middle East. So men's health needs to be looked at specifically to help for this.
I totally agree with that. Thank you. Yeah? We're all here advocates for men's mental health then. Before we start taking questions, in one line or two lines, what's the one thing you would want the audience to remember from today's panel? Dr. Adil?
It's always me.
Because you're really next to me.
The very important message, seek help. When do you seek help? Well, if you are thinking about seeking help, then you need it. So seek help. I mean, we come from different specialties worldwide. So if I need to build a house, I'll go to somebody who is specialized in that. If I need an IT support, I'm good in IT, by the way, but I have my limitations, so I'll go to someone who will help me in that. And also medicine. Medicine is a very delicate specialty, and it has many subspecialties. And mental health has its own people. So please, if you need help, go and seek it. If you think that I might need help or not, then you need it. So go and ask for help.
Thank you. Shuruk?
I second that completely. Exactly that. Seek help whenever you need it, and as soon as you need it, because the sooner the better. We know that the sooner we seek help, the better the outcomes. I think also another thing is getting used to the language of expressing our difficulties and expressing that we might be struggling, supporting each other and finding the words. So we might not, and this is true for children, they might be struggling, but they might not know how to put it in words. They might not know how to express themselves. We might be feeling unwell. We might be feeling that we're going through something, but we don't know how to share it because that's not something that we've ever been taught. So really...
So hold the space.
Yes, hold the space to be able to express these things.
Obviously, I support everything that's been said. I mean, I'll probably talk more to people in places of authorities because mental health is costly. It requires investment. There is no mental health on the cheap, okay? And for us to do that, and if we want to achieve Dubai 2030, the best place to live in the world, investing in mental health and coming from a low place, because in the Arab world, we have some of the lowest rates of psychiatrists and psychologists in the world. And things are improving, but we need structures, we need hospitals, we need clinics, we need awareness campaigns. And I think this will make, it will, in the long term, be cheaper to live in a society that's healthy and happy, and where people can go see myself, Dr. Sajwani, or Shuruk, and get what they need. I hope this will be something that comes out of all these discussions.
These are beautiful insights. Thank you so much. Do we have any questions before we wrap the panel? Yes. All right. Let me come to you and give you the mic. There you go.
Thank you. I have never understood when do I understand that I need help. I have pressures at work, personal life, in daily, it's on a daily basis. So is that what my concern is? That, oh my God, I'm unable to tackle this today? Or is there something, okay, when it's serious, I would know probably, you know. But what is it when you says you should go early, you should seek early? What is early? When do I realize that I actually need it?
When you ask the question. If you've asked the question to yourself, you need help. Now, what kind of help? This is where there are lots of answers, okay? And it depends on your willingness or your understanding of what's going on with you. You have so many options. And this is why I'm saying access is about you being able, I mean, we've made access easy for so many things, you know, ordering a cab, doing things, Deliveroo, all this stuff. We don't think about when I need help, what do I need to do? And it doesn't necessarily, again, need to go see a psychiatrist. There needs to be option. And we need to look at what is culturally acceptable and what is also affordable, because that's another limitation. You know, do I want to spend that much to see a doctor when I'm going to get like, you're okay, you don't need anything? So, you know, there are apps now for things, and again, these need to be regulated. There's so many ways to do that. But if you've asked the question, you should get an answer from somewhere.
Thank you.
First, thank you so much for this interesting panel. I'm a researcher in mental health myself and was very interested in all the points that you raised. And in the last answer, actually, you touched on the two questions that I have. The first one is, when I hear accessibility, I think about affordability for sure. And when you ask around, you ask people here, people are sort of generally into two groups: those who can afford it and actually seek help, and those, and in the same group, people who are insured, of course, and those who can't. I would like to know if you have any, for example, solutions or any thoughts about that. How can we push for affordability in the UAE? And the second question is, since you mentioned life coach, Dr. Adil, we've seen the rise of digital mental health lately, the spread of so many platforms and apps, and maybe it is a solution on one hand, but then on the other hand, is that a problem, and how can it be regulated or figured out in this scenario? Thank you so much.
Yeah, okay, well, thanks. Just regarding affordability, sometimes people don't know that their insurance covers, which I get surprised. Even sitting in front of me, I go, did you ask your insurance? Like, no, definitely they don't cover. And when they ask, it is covered. Now, there's a lot of variation. I don't have the data, and I think this would be an interesting research to do, because I'm not even sure that the authorities know how much of it is covered by the private sector and by non-private sector. And I think there are differences between the different Emirates as well. So it is something that we can improve. It's not as bad as people think, because if you compare to other countries, even like the US or other places, things are not too bad here. But I think we need to, again, share awareness with people. When you get an insurance, when you get a new job, do you ask about mental health? Do you feel empowered enough to say, do you cover mental health? Because then my employer will start thinking, why is he asking about mental health? Is he okay? Should we hire him? But these should be questions that we should be able to ask, just like we ask about other things. So I feel things are not as bad, but it'll be nice to have numbers for that. And there are options, again, you know, not everything is super expensive. But again, maybe the quality then doesn't follow, but this is something that we need, again, more data about.
I agree with Dr. Can you hear me? Yeah. I agree with Dr. Joseph regarding the affordability, and I think part of it, because most of the insurances, if you have a problem to afford a psychiatrist, you can go to a primary care physician. They all, cover it. But not all primary care physicians, they can support you for mental health. So that's the importance of training. So for public and private, they should increase the training of the primary care physician, family physicians, general practitioners. They are not there to give you a paracetamol, an Advil, or an Orios or Loratadine. They are there to provide the primary care part, and the huge part of primary care is mental health. Mild cases should be managed there, and the psychiatrist should be there when the primary care physician cannot manage you properly. Unfortunately, as I said earlier, most of the primary care physicians, they cannot do that. Why? Because they lack training. Sometimes they lack the policies. Sometimes medicines are not available at their clinics. And that's why what I did myself, I'm trying my best to encourage the mental health in the primary care as much as I can, and I refer to the psychiatrist when I cannot handle it myself. And I think that's bring the affordability to everybody, because everybody is insured under primary care, especially in Dubai. This is the first answer. The second question, sorry, what was it? The life, digital mental health, yes. Now, we have two scenarios in here. I mean, a few years ago, I was in the World Government Summit, and I posted that on my LinkedIn 3 days ago. Just Instagram brought me this memory in 2019. I was there attending, like you guys, so I was not in the panel, and 4 health ministers were sitting in this area, including the health minister of UAE and Lebanon that time. So they were talking about digitalization and AI might replace physicians. And I stood in the middle, well, will I be replaced? Then I need to find another job. So I was arguing with them that AI is very important, digitalization is very important, but you cannot replace physicians completely, because still human part should be important, especially for mental health. 3 years, it took 2 more years to convince everybody that AI did not replace physicians in COVID-19. So 114,000 healthcare providers passed away or died in COVID-19. Can you imagine that number? These include physicians, nurses, those who are working in the hospitals. So why we did not use AI? Because it's not mature enough, and because still the human part is there, and AI needs data. So the application, the digital apps for mental health are 2 types. Those who just answer your questions and give you a treatment or a suggestions, those are nothing, because those things take into part the PHQ-9 or GAD-7, the questionnaire which has been there for years, and they cannot diagnose you. It depends on your answers, and what's the difference between myself or Shuruq or Dr. Joseph when they do a PHQ-9 with the patient? They know the way to ask the patient. Those applications, you read it, you just answer the way you understood it, and you take a false number, and then you can take whatever treatment. So those are not accurate at all. While the most accurate parts are AI-based applications. For AI-based application, you need data. So AI, or artificial intelligence, is basically based on machine learning. For machine learning to give you the proper diagnosis and treatment, it needs big data. Most of the data are not generated in Middle East. So they are totally different. And for a country like United Arab Emirates with 200 nationalities, there is a big question mark if those data generated by everybody else will be applicable to you. So I think in future, those AI-based apps for mental health could help a lot, but right now I think they are doing more harm than good. But we need to know one thing very important. If I want to diagnose diabetes based on AI, I think it is applicable in few years. But to diagnose somebody with depression based on a mobile app, based on AI, you can do that, but you need more data. But again, you need the human part, because in mental health, the doctor judgment is very important than diabetes.
Thank you. We still have time for one question.
أهلين معكم الدكتورة نور مهيري مدير إدارة الصحة النفسية, and I would like also to comment on the question that came from our colleague here, that regarding the UAE government initiatives within the mental health, especially the National Mental Health Policy, which launched in 2017, and it has 5 main pillars. One of them is awareness and accessibility to mental health services. And at the beginning of 2021, we also had the Mental Health Act, and we are just waiting for that Mental Health Act to be within the press release, so we can also start implementing the Mental Health Act within our facilities. And one part within the Mental Health Act is the insurance, and to put the mental health services within the insurance platform. Another also channels in terms of accessibility is the hotline, free hotline services within the authorities, and we do have one. We call it Speak, We Are Listening in Emirates Health Services, and we served more than 17,000 patients in 2021. So this service is free, and I would like everybody, I mean, whenever you have this question, do I need to go? You can freely call our call center, and they will refer you to a certified clinical psychologist who will do this counseling and assessment, and later, based on the needs, they will stratify this call. So this is one of the initiatives, and we do have also in terms of digitalization, this is a major part within the mental health digitalization strategy. And whenever we look at any applications, we make sure that it is confidential and HIPAA compliant. And we do have also the HCT law that we follow here in United Arab Emirates. So thank you very much.
One quick, hopefully a quick question. I'm glad that I'm here. I'm just hearing a lot about the conversation. It's really, nice to see that there are more conversations about mental health. Is the tone of most of the conversations I attend are more about helping the people who have problems. Is there a way we could shift the conversation to a more positive stance? I'll give you an example. Let's say you tell somebody to go see their physiotherapist to deal with their weak core muscles. They wouldn't be very impressed. It's like, okay, they probably procrastinate, feel bad about themselves, need psychological help because of my comment. But if they go and see, I advise them to go and see their physiotherapist to strengthen their core muscles. It's something different. It's more about positivity, excellence, feeling healthy. And I feel at the moment we are so much focused, maybe out of need, we're focusing on the illness. Maybe we could shift just the viewpoint to the positivity of having positive psychological being, so you excel in your studies rather than just burn out and crash before the exam or something like that. What are your thoughts on this?
So basically the question is, could we shift the narrative with our awareness campaign to focus on not just the pain points, but the solutions and the outcomes of it?
Very interesting, and I agree with you. The problem, they don't necessarily negate each other, okay? Because depression, anxiety, OCD, all these things are medical disorders, okay? And so they fall under the healthcare umbrella and need to be treated. So it's not even an option not to treat them. What you're maybe hinting towards is more well-being, the concept of can we build, again, individuals and societies that are healthy and well. And again, this comes into, again, when people tell me about life coach versus psychologist, I tell them the starting point for me is, are you ill or sick, or that's psychology. If you're fine, you want to develop, that's for me life coaching, assuming the life coach knows what they're doing. So this is for me the cutoff point. So they don't negate each other, and definitely better societies, nicer cities, a cycling lane, working hours that are reasonable, all these contribute to the well-being part and prevent you needing the second narrative, but not fully. No matter how much we build amazing places to live, amazing societies, some people will still fall ill and require then the specialist or the medical health. I think we can do both together, but again, it all costs, it all needs investment and prioritization, and it's very nice to hear everything that's being done. The only thing I will say, me working in the private sector, sometimes we don't know about these things, and I think having better integration is very important.
Could I just say something to follow up on that? Because I think this is exactly it. We need to work on two different planes. The interventions, once people are already struggling, once people are already suffering from some kind of mental health condition. But then we also do need to work on these well-being initiatives. And this is where I believe that there is a place for all of these things that we mentioned today. Things that have to do with building resilience, these digital apps, there's space for that to support people who are not yet struggling with a mental health condition. Someone who needs a few basic tips on how to manage their stress. Someone who's struggling at work and they're going through a really hard time and they don't really need to see a therapist or a psychiatrist. All they need to do is just go attend a mindfulness workshop that will help them, that will give them the tools to manage that stress. So the more options we have, the better for people, because then the client can choose, the person can, you can choose from a menu of options. Going back to that Deliveroo example, you can then choose what you want to support your needs today, and these needs will change.
Thank you for pointing that out.
We're giving you a microphone, right? Hello. Assalamu alaikum. Can I add something? I'm here. I will speak in Arabic. Okay. اسمي مريم. بس حبيت أطرح نقطة أو يمكن هن نقطتين. تبسيط اللغة. Make the language simple. يعني إحنا نقول إن الناس أو يمكن العرب they don't seek الثيرابي أو الأدفايس لأن في ستيغما، لأن في هذا عيب، هذا منقود، لا أنا مو بمريضة، هذا مو بمريض، يعني أنا في مرض. ليش ما نستخدم المصطلحات البسيطة في الكامبين؟ أوكي، أنا الحين عندي حملة، ما بتكلم عن الأمراض العقلية، أو أنت عندك مشكلة، أو أنت عندك شيء، أنت عندك challenges. seek a help. يعني أنت بتقول له أوكي seek a help، يعني أنت اسعى للعلاج. يعني أنا مريض؟ لا، أنت مو بمريض. الكل يحتاج السبورت. وهذا يقودني للنقطة الثانية، أهمية العائلة. يعني إحنا يمكن في الفترة الأخيرة توجهنا مثل ما يقولون الوحدانية. أنا أكتفي بذاتي، أنا عندي نفسي، أنا أقدر أساعد نفسي، أنا بسأل أي حد. وين دور العائلة؟ يعني أحس إن دور العائلة تقلص وايد. يعني عندنا مثلا تلقى في إجازة نهاية الأسبوع الكل يركض لحاله، الكل يركض إنه يمتع نفسه. إنزين، وجزء العائلة وين؟
شكرا
يعني
كثير على السؤال. That's very
مش سؤال
important.
بس إضافة.
بعتقد Dr. Joseph, you have already covered the family part and the parents, but just to, as inspired from your question, Dr. Adil mentioned something that نحن مش متعودين. We are not used to having mental health conversations and discussions at home because of our parents and their parents and whatever it is. But I think now it's the time to us to break that chain and that pattern. So how could we encourage more families to break that and basically be involved or to invest in healthier generations مدى الحياة يعني without having these struggles anymore?
It's a very difficult question لأنه كمان the family sometimes I let the person define the family. بس when somebody comes and see me بسألهم أول شغلة who would you live with, okay, and who is the closest person to you, and you get very different answers. Okay, خاصة in big families, constructed families, the family is a very complex entity, and sometimes the family is the problem. يعني أوقات المشكلة من العائلة. So we cannot resolve things for the individual by himself. No person is an island, as they said. Everybody needs people around them. So the family is important as long as we allow the person to decide who do they want close to them, who do they think the problem is, and who do they think the solution is. أكيد we try as much as possible to involve people, especially with kids. أصلاً with kids, we rarely see anybody without their families. But كمان people don't want the entire family involved sometimes because everybody has opinion. Sometimes I have a patient and everybody in the family has an opinion on whether they should see me. Every single person. We're talking sometimes 15, 20 people. And that is more a prevention for seeking help. So the family is important and we definitely try to involve it, but we have to start with that individual. And awareness campaigns about families and allowing someone who is the head of the family, understanding why someone is seeking help, is already enough. Sometimes we don't need this person, as long as this person is not intervening negatively in the treatment or the care. And regardless what you said regarding the making things simple, definitely. When people come to see me, I tell them, talk to me as if I'm not a psychiatrist. And I say, imagine you're sitting on a plane next to someone and he asks you, how are you? How would you answer? Let me make the interpretation in symptoms way. العوارض تركع علي. You ask me, tell me what is the problem as if you're talking to somebody you just met. And we get to the symptoms then. That's the medical interpretation of it.
Thank you. Thank you so much. Any more questions? That's it? All right, so we have come to an end to this panel discussion. Thank you so much for your time and expertise. I think we have made a conclusion that seek help when needed and make sure you go to the right expert and professional. If you're not really sure, then we have a hotline and we have lots of campaigns and programs dedicated to giving the right tools, the right information, and the right resources. Thank you, Dr. Adil, Shuruk, and Dr. Joseph. Thank you for being here, and thank you for each one of you to make the time and for your questions. Let's make mental health care more accessible. Thank you, and have a beautiful day ahead.
Okay, thank you very much for this amazing session. Very informative. Thank you for everyone for accepting our invitation. Just as a token of appreciation, Dr. Noor Al-Maheri and Dr. Kulthum Al-Blushi would like to give you a small gesture.